Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we have a fantastic episode for you. We're going to be tackling the classic area of plastic surgery, which is breast reductions, but through a different lens. And I find that every single time I have a show about an area within plastic surgery that we've spoken about in the past through the lens of a new patient, there's so much more richness and more detail that we get out of it, because while it is the same procedure, everyone's journey through it is so uniquely different. And why I'm always so grateful when patients agree to come and A, take time, and B, be vulnerable, is that I know from just being a human that it's interesting what resonates with me may not resonate with someone else. And so it's invaluable for us to have these dialogues constantly, and that we're hoping as a result of our dialogue today, you who's listening may be moved in a way that will empower your life. So I'm always grateful. Dena is a fantastic patient of ours who is now a whopping 6 weeks post breast reduction. And the reason why we have her here today is that when I saw her at her 6-week follow-up, which wasn't too long ago, she was in tears. And the reason why that's so important to me is that my job as a plastic surgeon, which we don't talk about often, is not to create beautiful breasts or noses, is not to make a lot of money, it's not to be famous, is to take a skill or a talent or what have you. I don't like to even call it a talent because I'm fairly self-deprecative in that regard, but use it to improve your life or someone else's life. And while we get tons of grateful gifts and we get lovely reviews, when a patient is in your presence and is crying out of joy, it is the penultimate of our arrival to our destination. So, I'm lucky it happens. Maybe it doesn't happen every day, but it does happen and it makes me feel good. And then it tells me that we did good here. You can say attaboy for a change, and we did a great job. And so we're grateful to have you, Dena. Thank you for coming.
Thank you.
And so we talked a little bit off camera about what our subjects are today, and here's a couple of things. First of all, you're 48.
Yes.
Mother of 2 beautiful children, right?
Yes.
A 13 and 14-year-old. I think your daughter's 13.
Right.
Son's 14.
Yes.
You are an attorney, but no longer practice.
Yes.
And it's interesting because while the story of patients who get breast reductions has great similarities, there is differences. Most patients who get a breast reduction cannot wait for their breasts to be tiny because they're over it. I've had it. They're huge. I don't want to deal with this anymore. It was a problem then. It's a problem now. Just chop them off, Dr. Rahban. And then I am usually trying to educate them as to, no, that's not going to work. Because if I make them too small, they'll be ugly. And then I go through the whole geometry thing, and then I educate them that they need to stay large because you're wide and da-da-da. Yours was interesting. You like big breasts. As a matter of fact, you loved your breasts because it was your thing.
Yeah.
Like for me, when I was in my 20s and 30s, it was my hair. I had a mop of hair, but good hair. And it was that thing. It was like, it was a thing you got a compliment for.
Yeah.
It was that thing. It was like, oh, that guy with the nice hair. And so, as you had said to me, I asked you what your obstacles were. One of them was, it's my identity. I was having an identity crisis because the greatest asset of mine, not greatest asset, but one of the greatest physical assets, because you have many assets, was my large, full breasts. And here I am now contemplating undoing that. And you said you had a problem with the concept of your identity and the identity you would have. So let's elaborate on that, because I think that's very interesting, because most of the patients who get breast reductions hate their big breasts.
No, I had the opposite feeling and a huge concern. My large breasts were always a signature trait of mine. It was a feature that I loved about my body. I was not shy about showing them, whether it was in a dress or a tank top or whatever. And so one of my biggest fears was I'm going to get a breast reduction. And I think I even mentioned, can I just get a lift?
Right.
When I first saw you.
Sure.
And you were like, yeah, that's not going to happen. So I really had to wrap my head around this word reduction and what that was going to look like. Do I just have small breasts now?
Yeah, your fear was essentially, and we'll talk about we'll talk about it now. So on the same token, here they are. These are your greatest, one of your most beautiful physical attributes. Yet, why are you coming then? It's because you had said that you were 20, they were awesome. Now you're almost 50, and they're awesome, but not really awesome. They changed. So what has transpired over the course of 20, 30 years, 2 kids, breastfeeding?
All of that. So obviously it's 2 kids, it's breastfeeding. I'm now close to my 50s. Perimenopausal symptoms, the shape had changed, the nipple had changed, the shape of the areola was crazy to me. And so I didn't love them the way that I used to love them and wanted to love them. I just wanted my big breasts back that I
Correct.
loved. I wanted them full and high, looking at you, not looking
Right,
down.
right.
And so I became this person that didn't quite love them anymore. And they just became this thing that I would look at every day that emotionally started to affect me. And I thought, okay, well, if we can just get them back up and big, I'll be thrilled. So all these things changed the shape and the size and the look of this thing that I loved about myself.
Right, which is really interesting because I don't know that I haven't heard it put that way exactly in the past, but it makes sense. It's like I'm losing, naturally, I'm 51, and I'm losing hair,
Yeah.
right? Because it's going to happen.
Yeah.
And my hair is thinning, and I'm having a real, internal battle with that because it was my thing, right? And while I may have hair now and it's still fine, whatever, it's certainly not what it was.
Yeah.
And so I understand that. I get it.
Yeah.
And so here you are, you come to me and you're like, can I get a breast lift? I'm like, no, there's just no way, because you really had large, dense breasts.
Yeah.
And so your breasts were very thick. And when you try to lift them, the question people are asking is, okay, well, why not just give her big breasts and lift them? Because it's physically impossible.
Right.
Why I mean that is what happens during a lift and or a reduction. So a lift and a reduction are identical. All we're doing is elevating the nipple from their lowest point back to the midpoint. And in doing so, with a lift, we just remove skin. And a reduction, we remove skin and breast tissue. In your instance, because you had such dense breasts, there's no way to take the nipple from the bottom, rotate it to the top, and close, because the nipple will die. There's no room for it. It's like you got to get crap out of the closet in order to get the thing from the bottom shelf to the top shelf. Like you got to get the stuff off the top shelf. Yeah. And so when you do a breast lift in a patient who is deflated, you can compress it into itself. It's floppy. You just kind of, people who have floppy breasts know you just squeeze it all together. In a breast reduction, there ain't no moving. It's solid. And so you were forced to have tissue removed. And what you and I talked about, I said, listen, my objective is not to make them tiny. As a matter of fact, what I normally argue with patients about is that they need to remain large.
Right.
But Dr. Rahban, I've had huge breasts my whole life. I'm really over it. And I asked them, what would you like? Small C. I want a small, perky C. I can wear cute outfits and bathing suits and do yoga, and I don't have to deal with them. And they don't, oh my God, get rid of them, Dr. Rahban. I'm like, no, that's not going to happen, because if I do that, because you're wide chested, which I can't change, you'll have an ugly, flat C minus, not a small, narrow, cute C minus. And when you phrase it that way, you're like, oh, well, I don't dislike them that much, where I'm okay with small, ugly breasts, right? And you're lucky in that you wanted still large breasts. And I think I kind of reassured you. I know that you were still unsure that your breasts will still remain largish. Whether or not they were large enough to you, I don't know, but they sure as hell weren't going to be small little, cute little round little balls.
And they're not.
Right.
They turned out to be, I don't know if you'll remember this, but in our first meeting, we were discussing size. And one of the first things you asked was, what do you want to be? And I said, I want to be a triple D.
Right. And I have that written down in your chart. I looked at your chart before, and because I always look to see what patients say.
Yeah.
And you wrote, and it says triple D, which is unusual. As I said, if I look at 100 charts, they're all going to say C.
Yeah.
Small C.
And I was like, no, I want a triple D. And you were like, okay, so you want big breasts. I'm like, of course, like this is who I am.
Right.
And so then you educated me a lot about geometry. And there was a lot of measuring going on. And I know we had even another discussion where I said, well, what if I just tell you to go a little larger than what you think I should
Right.
have? And you're like, yeah, I mean, we'll do that, but you're still going to sag. And I was like, well, that's just not, that's not what I want to do.
Sure.
And we got to this place where I said, I'm going to trust that, you would give me what's right for my body. And right is appropriate, right? All these words are like meaningless because
Sure.
your right and appropriate is different than my right and
Exactly. They're all
appropriate.
subjective.
So, but I got to this point, and it was a lot of because I had been following you and listening to your, Instagram posts and, your reels and podcasts where I was like, I had no doubt that you were probably the most confident plastic surgeon that I had listened to, just an expert in what you were doing. And I thought, like, you go to the experts for a reason. And I thought, I'm just going to let him do what he does. And I'm so grateful that I did because I I still look at them and I'm like, I have my big breasts back. And they're beautiful.
Makes me very happy. One of the things that's interesting is that we don't get to that place by you deferring to me. We get to that place because I earned that from you.
Yes.
So I want people to understand that, yes, I am the expert. I have been doing this for 20 years. Yes, I am confident in what I know. And Sally, who's my office manager of 20 years, will tell you I am not confident when I don't know.
Yeah.
It's not this blind arrogance where I'm like, I know everything.
Right.
No, I know this area inside and out. You ask me about something that I don't do every day, I'm going to have a ton of reverence for it in that I'm going to be like, oh, I'm not sure. So even though I know all that, I don't come in saying, listen, you got to trust me. This is how it's going to go.
Yeah, no,
I don't do that because it doesn't work.
It wasn't that.
It's a process, and I have to get you to that destination, and that requires at least 2 45-minute or an hour sessions together where we draw and diagram and educate and back and forth and explain so that I can educate you to the point that you do then say, I surrender, but you do so willingly, as opposed to me hitting you over the head and forcing you to do it.
For sure.
And I think that one of the things that you had also mentioned to me, because I asked you specifically, what were your concerns? And one of your concerns, aside from the fact that you love large breasts, which is, I like large breasts, I like small breasts, I like small noses, it's just a personal taste, is that you thought, okay, well, I'm definitely not a petite young lady.
Right.
You're full figured, you're curvy, you've always been that way. That's part of why you loved your large breasts, because it totally worked with your frame. Am I going to get small breasts and now be like my fat belly and my huge ass and my thick thighs? Is that what's going to happen? Which makes sense, right? Am I going to become disproportionate?
Yes. It was disproportionate, but it was also now these breasts that I love that are still large and high and perky and full. Is it going to draw attention to my not the flattest stomach or the wider hips or the thighs that I don't want, that are bigger than I would ideally like for myself? I felt like shrinking the breasts, then I and other people would focus on the very things that these things were hiding for me in the past.
Interesting. And there is some truth to that, and there is a psychological component to that. Some truth to that is, okay, well, I fixed the living room. It looks fucking amazing.
Yeah.
Wow, the kitchen looks like shit.
Mm-hmm.
Now, it's not that you fixed the living room and now the kitchen looks like shit. It's just like I finished one project, I can go on to the next.
Yes.
So people think that if I fix something, will it draw attention to the next? It's not that it draws attention to the thing. It's just like that one item is now no longer on the table.
Yeah.
So I'm hoping that if anything, it's just sort of made you globally love your body rather than be like, now I need to be critical of the next item.
Well, you kind of hit the nail on the head because after surgery, I went online and started buying new gym clothes because of course I need a new sports bra and all this other stuff. And I got my first set of matching gym clothes like that. I haven't done that in years.
You actually bought a size medium, I'm making up, and the top and the bottom came as a package.
No,
you didn't have to buy a different.
I mean color and material.
Well, normally you would have to buy a top separate from a.
And I didn't actually, frankly, I didn't care because I wasn't going to show it to anybody. I was going to put my sports bra on and throw a big T-shirt on and have something tied around my waist and go to the gym and put my head down. And I went to the gym the day after our 6-week appointment with my cute matching sports bra and the bottom. And I cannot tell you, I mean, I'm getting emotional emotional kind of even saying it to you because my husband works out with me. Well, I work out with him, I should say. And I just felt beautiful. I felt sexy. I felt energetic. And I was just like, oh, I'm putting on this matching gym
So
outfit.
simple, right?
Something,
So
yeah, it's
something that for someone else
is
is like,
just
whatever. What do you mean? Of
commonplace.
course, I just go to Aloe and I buy whatever. What the hell?
Yeah. And
It-
I did it. And it was such a beautiful, exciting morning because I just put on this new gym outfit. And, I used to look at other women at the gym and be like, God, their breasts look perfect in that sports bra, where mine felt like one sandbag across my chest.
for just for the sake of discussion, you're about a full D now.
Yeah.
You'll see
Yeah.
when you go. What size were you before? Just so everyone kind of can, in their mind, this isn't some little reduction.
I was a G.
Right, a G.
Yeah.
And so people come and tell me they're a G all the time, and I
Yeah.
examine them like, you ain't no G. That's
Yeah.
just a double D.
You actually told me I was a triple D.
Right.
Because remember when I said I want a triple D, and you're like, what are you wearing now? And I said I'm wearing a G, and then you examined me, and you were like, you are a triple D. And I'm like, no, I'm not. I'm a G.
Yeah.
No.
So what happens is part of the reason why it's interesting because sizing. So I like, oh, what do you weigh? I weigh 170. Let's stand on the scale. It says 180. Then you weigh 180.
Yeah.
The scale doesn't lie.
Yeah.
Oh, how tall are you? I'm 5'5". Well, this tape measure says you're 5'3". So those things are 100% accurate.
Right.
Bras, random.
Yeah.
You and I right now can walk into 3 different stores, pick up 3 different bras, 3 different bathing suits, and you're 3 different sizes. One tells you you're 32Q, one tells you you're 36G, one tells you you're 34D.
Right.
So that's why it's meaningless.
Yeah.
Because after you get to a certain point, there's just some arbitrary number they
Right.
make. Nevertheless, the point being was that you were afraid that they would now not love your totality. And just that idea of wearing clothes and going to the gym and being a normal, ordinary person was extraordinary.
Yes.
And so that's very, very beautiful. The next thing you had mentioned to me as far as concern was, okay, I'm a pretty intelligent person. I'm a worldly person. I'm a well-read person. I consider myself a very reasonable person. Isn't this a little all too vain? Shouldn't I just be able to be like, Dena, just love yourself.
Yeah.
Listen, people grow old. You're not going to be able to chase every little wrinkle. You're not going to be able to, oh, now I have neck skin. Oh, what about the wrinkle under my eye? Wait, what about this fat in my thigh? Where are we going to draw the line here, Dena?
Yeah.
And shouldn't I just, and what message, this is what you told me, what message am I going to tell my 13-year-old daughter? Like, oh, honey, it's okay if someone bullies you and you don't like it, we'll just change it.
Yeah. No, on an intellectual level, I was very much like, you should love yourself. This is God-given. You were born like this. Embrace it. It's still voluptuous.
And your husband never made you feel bad.
No, he loved it. He thought it was great. He loves these too.
Yeah, so no, the reason why I say that is for a lot of people, they assume, at least my patient population is an incredibly healthy patient population. By that I mean they do things on their own volition. We don't really get a lot of like, I'm here because I'm an OnlyFans and I have to do it for work. I'm doing this because my husband and I are, it's because I want to.
Yeah.
So I almost always hear, my husband doesn't even know why I'm doing this. He thinks my nose looks great, my breast looks great. So that's beautiful.
No,
so
he definitely was. It was more like whatever makes you happy. If you're uncomfortable, do it. I support it. If you stay like this, I love you. I support it. It was just me wanting to say to myself, I can like myself this way too.
Right.
And so why go do this? And then, yeah, I did. It wasn't just me thinking about my 13-year-old and what I was going to explain to her. She asked me directly, like, why are you doing this?
Right.
You're
That's very interesting.
Are.
So how did she know you're doing it? You told her mommy's having surgery. Okay.
I just told them. I mean, I said, I'm going to get a breast reduction.
Okay. And what did she say in particular?
She said, why are you doing this? You're beautiful the way you are.
Right.
And I told her, I am beautiful. I do feel beautiful, but I'd gotten to the point, and really it was only in the last 2 or 3 years that I had gotten to the point where I was just unhappy. Before I was dealing with it, and maybe my body has changed in the last 3 years, hormonally, the shape, whatever it was. putting on an outfit, putting on a dress. I showed you a photo before and
Yeah,
after.
yeah,
Yeah.
it's pretty remarkable. I love those transformations. The
Yeah.
transformations are
I
incredible.
mean, I even looked at the photo and I was like, why did my family let me out in this dress like this? I mean, it's crazy. And so I became just emotionally unhappy to the degree that, again, I didn't shop for clothes. I didn't want to dress up. I just stayed in like my normal bra and, I put leggings on and a, tank top
Yeah,
and moved on with my day.
you sort of surrender.
Yeah.
And there is a difference between living with vigor and living out of complacency.
Yeah. And so I told my daughter, I'm just, mom doesn't feel happy anymore about, like, emotionally, this is starting to affect me. It's uncomfortable. It's difficult to live day to day like this. And so that's how I explained it to
And
her.
when you say mommy's unhappy this way, I think that probably makes the most sense to
Yeah.
them because they get that. Because
Yeah.
a child understands
Yeah.
beauty doesn't make sense to them because at that point they're like, what do you mean? You're perfect.
Yeah.
So it's more like happy, sad, those kinds of things they get, which
Yeah.
is, I think it's well put.
Yeah.
And I think the last thing you said to me, which was interesting because it was the thing you said to me all the way to the very end. I mean, literally they're putting this, doctor. I mean, to the very end was, don't let me die,
Yeah.
which I find fascinating in that here you are, this obviously very well educated, structured person. In other words, I have different patients with a lot of stress. Their energy's a little flighty. They have a little bit of hysteria to them. I kind of get it. They run very anxious.
Right.
You don't lend me with any of that anxiety energy.
Yeah.
Always very poised in our dialogues, never really emotional high or low, whatever.
Right.
That's why when you cried, it was moving because it was nice to see that aspect of you. But this whole conversation you had with me on multiple occasions about dying is so irrational
It is.
and so emotional. And then I asked you, I said, what is this all about? And it was this notion, which is very common amongst mothers, amongst elective surgery.
Mm-hmm.
If you were a dad having a gallbladder removed, it wouldn't have been a dialogue.
No.
It's because you're a woman, so you're the mother, like I have this responsibility. And what if I drop dead? And oh my God, at my eulogy, they're like, I was having a breast reduction.
Yeah.
It's like,
that's the legacy you're going to leave your kids, is that mommy had needed to get her boobs done and she died. That's the legacy that you think you're going to leave to your children.
right. And so we got to unpack that on 2 or 3 different levels. The first is, why the fuck would you die? Let's forget about that if you died.
Yeah.
Why would you die? You are not jumping out of an airplane without a parachute.
Yeah.
You are literally having general anesthetic, which has now been around for almost a century, in a highly vetted, I didn't vet it, you vetted it,
Yeah.
highly vetted environment by an individual that you are trusting to rearrange your body. And it's not uncommon. Dr. Rahban, I trust you 100%. No, I am certain you will crush it. I'm just afraid of anesthesia. And so, which is again, it's an irrational fear.
It's completely irrational.
Which is interesting. So we reiterate, that's why we have the podcast for the anesthesia. We have it because you're not the only one. Mm-hmm. It's a lot of people that have this fear of dying and not waking up and not being there for their kids because it's elective and it wasn't necessary. So that's the first thing. You're not going to die. The statistics, is I mean, it's not going to happen. And then the other is the guilt associated of moms doing something selfish.
Yeah.
It's selfish in that it's about you.
Yeah.
But it's really not selfish because tell me how much happier you are.
I mean, well, obviously it took weeks to get to that point. Like,
Sure.
I saw you at the 2-week appointment and I was still kind of like, whoa, hold on, and then 6 weeks comes along and you walk through the door. I barely said hello to you and I just started crying. And it was because I could not, one, I was extremely grateful that I got out of surgery safely.
You're alive. Yeah,
I was just like, I'm alive. And two, it was that my breasts were large and beautiful. So it was this thing that I'm like, I can't believe I finally got here. I'd waited 10 years to do this.
It's kind of like a relief kind of.
Yeah, I had waited 10 years to do this. And just going to back to the idea of the irrational fear, it's completely irrational.
For sure.
And as much as, I had known you, I'd followed you on Instagram, I had listened to your podcast
Sure.
and seen all these stories. And maybe it is a common fear of mom goes, oh, I don't want to die during surgery. I just don't think moms say it or were maybe feel silly saying it. And even when I said it to you, I felt silly because I'm like, this is so stupid. I'm not going to die. And he's not going to let me die. I mean,
Right, but but that's the whole point of an irrational fear is that I know it's irrational. It's not grounded in anything, but I still feel it. It's still a valid emotion, even if it's crazy.
yeah.
It's still a valid emotion. It's just so fascinating because it's not uncommon, and it's so fascinating because it's linked to moms and doing elective
Yeah.
surgery.
And I
Because
think
if you had a fibroid that was
it would have been a
bleeding,
non-issue. I never would have said
you
anything.
wouldn't even like, mommy's got to get this thing
Yeah.
out. It's bleeding. It's I'm anemic and I got to get the thing out.
But what I think was important for me to know after I had vetted you is I need Dr. Rahban to know me. I'm a mom and I have 2 kids. And so when I said it to you, you said something to me that changed everything. You kind of smiled and you said, like, obviously I want to give you beautiful breasts, but your safety is paramount to me.
For sure.
And so I'd been nervous all along. And that day, I remember saying to my family, I'm like not nervous about this surgery anymore. Because I told him, and he told me that it's not just this vain thing, like you're going to walk out with amazing breasts, and that's really all I give a shit about.
Right.
It's also like your safety is paramount to me. And that was kind of the moment that there was a shift. Like I came in here the morning of surgery. And Javier, my husband's a fireman, and he was actually supposed to bring me, but our surgery time had changed. And so I drove myself, and I thought, I can't believe I'm actually driving myself to this surgery and feeling completely like I'm going to be fine because I'm going to get out of this surgery and it's going to be fine.
Yeah. It's kind of one of those things that you just got to get off your chest.
Yeah.
And then you have to be received.
Yes.
So it's like, I just want to get this off my chest and I want to be received and then I'm done with it.
Yeah. And that's what happened.
Yeah. Yeah. And I think, I've had many, 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 many moms express this, as you said, probably almost all of them have it, whether they express it or not is the question.
Right.
And I think it's just a very beautiful aspect of motherhood, which
Yeah.
is this, I have this ultimate responsibility to my family. And so, I'm almost willing to forego my own happiness. The beauty of this story is that it's not one or the other,
Yeah.
right? They're not mutually exclusive. They're together. You can, and that what I tried to share, and I think now you can maybe understand it with your own eyes, is that you are now a better mother.
Yeah.
It's like I can't be. I mean, I would give my kidney to my kids. I understand, but you're a happy person,
Yeah.
and when you're a happier, glowier person, you are nicer to your kids. There's this inevitable underlying unimaginable slight degree of resentment that these creatures have altered your life in a weird. Your husband is only looking better every year, not getting changed. You piece of shit. There's an underlying unspoken, like, you're this thing that just had to like destroy your life for these people.
Yeah.
And you would never express it. It may be so deeply buried, but when you're happy, everyone's like, oh, fuck, mama's happy.
Yeah. Well, and the thing about it is I've found my femininity again. As much as, you think like, oh, big breasts, I actually said that to someone where I'm like, I don't feel feminine anymore because they were so big and it wasn't this thing of beauty that's, that a man looks at and goes, God, those are beautiful. I just felt, you have sex and they flop to the side.
And
like, what's feminine about that? You know? And so like all of this stuff, it's like, it's just not feminine anymore. And now I put on an outfit, I do my hair and my makeup, and I stand tall, and I've found my femininity again.
Yeah, it's very powerful, and that's very well said. And I think that's really the secret power of women. I always used to say this as kind of a truism. The most powerful creature in the universe is an attractive woman. Attractive is a relative term, meaning they feel themselves to be attractive. Yeah. The second is going to be an attractive man. The third is an unattractive woman. And the fourth is an unattractive man. But no one can trump an attractive woman. Yeah. There is civilizations that have been brought down to their knees by attractive women, and that's the superpower. And the superpower is feeling attractive. I mean, there are so many men who have destroyed their lives with very unattractive women who thought they were attractive, right? Yeah. So it's really a concept.
And it's confidence.
That's where the attraction I'm talking about.
It's like, I mean, I think that for the large majority of my life, I felt confident in many aspects: my physical appearance, my face, my breasts, my career, my education, all these things. And somehow this part of me, I lost that confidence. And so I felt less attractive, and I'm seeing now that this is
Yeah.
like coming back.
Yeah, it's
you know?
interesting. You'll see, I think in the next, because it correlates to the changes in the physics of the breast, the physicality of it. In the next 3 months, as things really come together and soften and rounded and everything comes together, will correlate with all of these new experiences that you will have, which will then highlight the cloud that you had before.
Yeah.
You don't know how well you breathe until you breathe better.
Yeah.
Like, oh wow, I've been breathing like shit. This is breathing?
It's
Oh my
true.
God, I didn't know. I thought that was my baseline. And so you didn't get there, yesterday. It's been a gradual sort of simmer, if you will. And so now you in the next couple of months, you'll start to, oh my God, this is pretty cool. Oh my God, that's pretty cool. Wow, that one I didn't expect.
Yeah.
Right. And
Yeah.
so it's going to be great. Well, no one is happier for you than me,
Thank
right?
you.
Because I put a lot of time into each of the patients. Of course, naturally, our end goal is for you to have a beautiful result, but really it's for you to be happy. And so the whole staff is happy for you, and we're grateful that you came on the show, because we always like to highlight not just happy patients. That's not the purpose of the show. It's to highlight critical elements of their journey.
Yeah.
And I think yours was very apropos. It was very, boom, 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 boom. And we'll have to get maybe a follow-up from you at the end of the year.
Yeah.
Maybe you'll be like, I don't know, like on some runways model or something. Maybe you have a new career coming, a confidence I'm talking. Okay. Any parting, one recommendation, suggestion, thought, what have you, to a person out there listening, very large-breasted, sort of in your mind space, you kind of get it. What would you suggest? What would you say to them right now?
The mind is a powerful thing. And I think that once you can kind of get out of the emotion of all of these different things that we talked about, your identity and these features that define you, motherhood, that's a beautiful thing, but sometimes constraining in a million different kind of ways, and get back to the rational idea of, it's 2025 and you're, with a seasoned surgeon, an expert in the field, there's an anesthesiologist, and you can kind of rationalize all of these things and not give in to the guilt and the fear and all of these things. It requires intentionality.
Sure.
And
But you can make it.
But you could, yeah. I mean, and so I think once you get into that zone versus giving into all of these, the noise that really does infiltrate rationality and intentionality, you can get to a place where this feels okay. It actually feels like it's the right thing to do, actually.
Yeah, very well said.
And so once you get there and then you get to the result and say, oh, that was right. I think that's a really important kind of exercise to do, especially as a mom.
Yeah, I agree, and that's very well said. And at the end of the day, each person has their own individual journey. So just have to find your own path. Yeah. All right, guys. Well, that's going to wrap up another episode of Plastic Surgery Uncensored. I hope you enjoyed this episode as much as we did. As always, I have 2 requests when we end each episode. One is, if you're listening and you're on a treadmill, get off and go write a nice review. I don't want to hear any excuses. Just write a goddamn review. Something pleasant, something nice. People work very hard to put this show together, and hopefully you're enjoying it. And secondly, share the show and episodes with people you love. You have no idea which friend of yours is struggling with the exact same thing that we talk about. So the more you share it, the more people you help, the more grateful we are. All right, guys, that's a wrap. As always, we'll see you next week on Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban.